Mary Kay Woods, and I actually am a born Ansonian. I graduated from our school system from Anson Senior High in 1991, and after being a nurse probably about 15 years, I found myself back here in our county. I heard of the Child Family Support Team initiative was being, they were actually hiring nurses and social workers. And my mom actually is a retired Anson County School District Office personnel person. So anyway, she told me about the positions and actually called me while I was on vacation at the Outer Banks and said, "Mary Kay, would you like to apply for a job? We have openings." And I'm like, not so sure I'm gonna do school health because I like the fast pace. But little did I know, school health was very fast paced. It's just a different type of pace. So I was glad to come back home because I wanted to give back to the community who've been so gracious to me for all my life. So I've been back here, and this is my year 17 in Anson County Schools, and I really can't think of any place I'd rather be. So I must confess that I made 3 appointments and I canceled 3 times. And on the 4th time, I actually got vaccinated. And the deciding factor was, I called my allergy doctor and talked with him. And he's like, "Mary Kay, you've had the MMR, that's very similar, you should be fine." And then I actually went into his office for a personal visit, and he said, "Mary Kay, please tell me you're vaccinated." And I had not been. So that day I got on the phone, called the health department and said, "Please reschedule me." And they said, "Okay." And I said, "I'm really going to come this time." And the health department was like, "Mary Kay, you've got to, we'll come and hold your hand." I'm like, "That's fine. Please somebody come hold my hand because you're in a drive-through clinic. You're by yourself in your car." And I could have had somebody in there with me, but it's the fact that, okay, let's be a big girl, let's do this. And so when you do this kind of stuff, people, they will follow your lead because it's like, if you do it, then it's okay to do it. It's just like leading by example. I think if a healthcare professional on campus is willing to do it, then people are going to like, yep, if she thinks it's okay, then I'm okay to do it. And that's actually what happened at my school, in Ansonville Elementary School, is that I prepared like information for the staff during staff meetings, and I actually, they would text me, they would send me emails. We have they come to office where we talk about their concerns, my concerns. It's like a big a hash out meetings, because they were scared. So pretty much, I tell them, I said, I can't tell you what to do, but I can provide you with information and let you make your own informed decision. Because as nurses, that's what we do. We educate, and then we want people to make their own decision based on what the information we have given them, what the rule is, and those kind of things. The school system, what they did when we scheduled our appointments, they worked with us. Like if we had an appointment on Wednesday, they were very gracious to us because they knew that side effects could happen, and so we kind of had planned ahead of what that absence. So we tried to schedule them, to where it could be a Friday if possible, but sometimes we couldn't. But they were very gracious with us when we had to do them in the middle of the week or on Monday, whatever. Just so we were out, they did help take care of that. Even though we're focusing on the adult population, get our staff vaccinated, kids take home information. So I think a lot of times we underestimate our children, but they're the ones who go home because they hear things about the vaccination too, and they go home and tell their parents, because when we're teaching about COVID in the classrooms, we say these are the different options you have, and so they take that home to their parents, and then the parents are like, "Hey, my kid knows about this, so maybe I should ask questions." And I actually had parents to call and ask, and so we could set them up for different locations. They could go to different places to get vaccine. I just feel like the parents doing that disclosure and being honest with them, even though I didn't have to be, but I just felt like it was best if I disclosed, "Hey, yeah, I did my vaccine." And then they would ask me, "Can you tell me where I can get my vaccine?" And that kind of, it just kind of was a domino effect. And then actually some of the children were vaccinated. The parents went and got vaccinated, and then they brought their kids to get vaccinated.